elbow supination and pronation. So in this particular video, we're going to talk about our elbow joint with our elbow extended, and we're going to transition between a pronated, neutral, and a supinated position. And in doing so, we're going to use a 6-pound sledgehammer as a way to drive load into that joint. So for most people, especially the people that are in an acute stage, meaning that their elbow is irritated, a 6-pound sledge is going to be way too heavy. There's a lot of different materials that you can use for this. You can use dumbbells by holding one side of the dumbbell. You can take like a water bottle, fill the water bottle up with water, hold one end of it, those types of things. I prefer some variation of a sledgehammer or a hammer because the weight on the head stays the same, and by just slowly moving your hand down the handle, you can increase the load that goes into the joint very slowly over a period of time. So typically we'll start with an elbow bend, and then as the irritability decreases, we'll kind of change the elbow position. It seems that most people have the most discomfort when the elbow is in a fully extended position. So for demonstration purposes, I'm using an exercise ball on top of some plyo boxes to set up the right position to be able to hold my elbow in extension and also have the handle clear the boxes here. So starting in a neutral position, elbows are going to be extended. I'm going to supinate as much as possible. Come back to neutral, and then I'm going to pronate as much as possible. And you notice I'm keeping my left hand kind of on my upper bicep here, so that way I can kind of notice if I start to cheat and rotate into my shoulder. And then if you can use a mirror, but if not, you need to be mindful that you're not just side bending or moving through your trunk, because all the motion should come at that elbow joint. If you find that the weight you select is too irritable with your wrist all the way extended, a couple things you can do, with your elbow all the way extended, a couple things you can do is slightly bend the elbow and go through the same progressions, or lower the weight and keep that elbow all the way extended. It's common to feel, or it's normal to feel like a stretching sensation and some pressure into the joint just due to the setup and the nature of moving throughout that range of motion. You're trying to move through the greatest range of motion possible without increasing your symptoms, and that's going to be dependent on your injury, how far out you are from your injury, the tissue's capacity for loading, all those types of things. So the only way to know is by starting somewhere and trying. And then the last piece that I want to touch on is usually the holds. So 3 to 5 seconds, somewhere in that ballpark, is a really common duration that we'll have people hold in end range. It's also not uncommon to have us request that you hold it for 10 seconds. So pay attention to your programming to make sure that you are following the guidelines correctly. And as always, focus on quality over